Suicide is a problem everywhere. It's especially increased in middle-aged men. But the suicide rate for women has increased about 31%.
1 in 6 suffer from depression. 1 in 10 college kids have a plan to take their lives. I had no idea. Nobody ever talks about it.
About 80% of my clients are bipolar. Bipolar diagnosis comes with a pretty high, at least attempting of suicide. It's over 50 or 60% have at least attempted suicide.
Teen suicide is an absolute epidemic.
So the doctor told me that I was bipolar, and that was, to me, it's very shocking because I just thought like, well, I've seen movies of people who were diagnosed with bipolar, and that's not me.
Dissociative identity disorder, that was when I was 17, and anxiety disorder.
Well, first they diagnosed me with ADHD, which is a huge problem because if a child is misdiagnosed and they give them the wrong medications, and they can make the disease even worse.
My diagnosis is severe depression.
Major depression.
I started, slipping into depression.
From the time I was an infant, she started allowing men to sexually abuse me. This was before anybody talked about trafficking or anything like that. It just was sort of unheard of. I was telling people going on. The school knew something was severely wrong, but they really didn't understand.
My mind was racing all the time and trying to rationalize what was going on with me. And I felt as if I was standing looking down into an abyss and trying to decide if I should jump or not. And sometimes I felt like I could go to the left, I could go to the right, I could stay where I am, but anything I did would be useless. And the only thing I could think of just to stop all of the pain I was having was to end my life.
Helplessness, I felt like I wasn't capable of doing anything.
And at the age of 15, I guess that's when I was at the darkest point. I cut myself.
I had friends that didn't trust me with their kids. They thought, if this is all true and she was sexually abused, she might abuse our kids.
I believe that society has turned their back on us.
I ended up getting addicted to the internet. I started realizing that I could live in another world and be another person and make friends with people who didn't know me.
There's a hopeless feeling of, this is what I'm going to have to deal with the rest of my life. And how do I deal with that? I can't keep a job. I can't keep a relationship. I'm living at home with my parents and I'm 35. All the rest of my friends have passed me by. I can't do anything better than this. This is it. So why would I keep on living?
So the Will to Live Foundation is a nonprofit public charity, a 501c3, that my wife and I started 5 years ago, about 2 weeks after the suicide death of our teenage son, Will.
The physical aspect of the pain was very easy to talk about, but I don't think I've even admitted it to myself that there was a connection there because who wants to be looked at as crazy or that you're causing yourself pain? Or if you know how to control it, why do you let yourself get there? Why do you get upset?
We had absolutely no idea that our boy, big, strong, handsome, healthy, successful, popular, a great athlete, a great musician, and a great student, was struggling. We had no idea. He was living what we thought was a perfect life, and then he died of his own hand.
There's so much fear. I believe the stigma will kill me before I do.
One of the things that increase stigma around mental illness is the language that we use. People are not their disease.
And I did everything to avoid admitting it.
And that's one of the biggest pieces is I punished myself so much because it was taking me a long time to heal. I thought, okay, it's done. I should just be over this.
When you look at the symptoms of bipolar, someone with, manic episodes, I have some of these symptoms. And it would be really hard for me to lie to myself about not having them.
I, a lot of times, doubted what was going on with me. I half the time didn't even believe myself. The memories.
It felt like she was calling me crazy. I just thought it was a nice way of saying you're crazy.
It's okay to feel bad. It's even okay to feel like you don't want to go on living. The problem is when no one talks about that, when it just gets left there and remains stagnant, that's going to end up festering and end up getting worse and worse and worse and worse.
So you develop these bonds as teenagers that stick with you your whole life. And Will just didn't know that. And I thought, gosh, if he just would have understood that he already had these close friends, maybe he would have reached out and talked to them.
Most important thing is to ask the question, to not be afraid to ask the person, are you thinking of harming yourself? Are you thinking about suicide?
If you're looking at someone, if they've started to kind of separate themselves from the group, if they're isolating a lot, that is one particular symptom.
Watching for warning signs, and those warning signs are changes in behaviors. It could be anything as simple as eating or sleeping habits changing, isolating themselves from activities or friends. It could be giving away possessions, making final arrangements, and also, of course, anger and reckless behavior, taking risks for young people especially.
Earned my 2 bachelors, and then I decided to travel the world because that's what I wanted to do.
I've really focused a lot on changing my attitude about myself, becoming much more positive about myself.
I wrote a therapeutic wilderness program for families because from my observation of being in a therapeutic program, that the family component was like pretty much non-existent.
My mind has to stay occupied because that's what I've done in the past 2 decades. Like, I have to occupy my mind.
Well, I ran a marathon a couple of years ago. Just decided it was something I wanted to do, and I set out to do it.
I had been clean from alcohol and marijuana for that was what I was battling with for over 7 years.
The biggest thing you can do is talk to a person.
You are amazing.